Hello, hello. Good morning, everybody. Welcome to today's Ask About Asthma conference. My name's Oliver Anglin. I'm the Clinical Director for Children and Young People, the Children and Young People Transformation Programme for NHSC London Region. I also chair the London Asthma Leadership and Implementation Group. Again, I'd like to welcome you all and thank you for joining us today for our 8th Ask About Asthma conference. This is part of a week-long campaign raising the profile of asthma in children and young people and the impact that it has on their lives. So before I get into my introduction, I'd like to do a little bit of scene setting. So first of all, we're going to play a short video from somebody that many of you will know or have heard of through the press, Rosamund Kissi Debrah, who is a tireless campaigner for children's asthma in general and the impacts of air quality in particular, and is the founder of the Ella Roberta Foundation. Peerless and tireless campaigner for children's asthma, and so was going to be speaking with us live. She will tell you why that's not happening right in this moment in her short video, but then also she will be joining us for a Q&A afterwards. So without further ado, I'll hand over to Rosamund, and then I will pick up again afterwards.
In
Oh,
London. So I'm really proud we now go all over the UK. For today's theme, hi everyone, and good morning to the 8th Ask About Asthma. My name is Rosamund Debrah, and I am a clean air advocate. I first started working with the team, I think in 2015 or 2016. And when we first started, it was just mainly London. So I'm really proud we now go all over the UK. For today's theme, we're going to be talking about the quality of life, especially for people with asthma. I must apologize for not being with you because as you watch this video, I will be on Sky News because there is a new report out that every playground um, in the UK exceeds WHO limits. So the children are breathing illegal levels of air pollution everywhere. And due to the current climate, it's extremely difficult to get anything on the news. So please forgive me that when this report came out and Sky News wanted to cover it, I jumped at the opportunity. And I hope whilst I'm there, I will have the opportunity to also ask about asthma and the great work you are all doing. As I said, sorry if I'm repeating myself, it's about the quality of life for today. And we know that 3 children in every classroom have asthma. So we need to think about how they are most impacted. We now know that one of the triggers for asthma, if you look at the new action plan on there, air pollution has made it on there. And we also know that during high air pollution days, more children are admitted to hospital. Currently, I am talking to the government and the Mayor of London. Um, One of the things we do want to do is we want to go back to the prevention of future death reports because the coroner was very clear in there what needs to be done. As you are all aware by now, air pollution was not in the manifesto or the King's Speech, and the Environment Improvement Plan is currently open, but it will be closing at the end of the year. I desperately need you all to use your voices. We need to get some of these things on air pollution in the environment improvement plan. Otherwise, I do worry this will be an opportunity missed. My concern remains that asthma isn't taken seriously because it's so common, and people are still shocked that people die from asthma. And it's worth me repeating again, and I say it in my head all the time about our asks, that every child who has an asthma diagnosis has an asthma plan. And this isn't something that needs to be put away or hidden. They should have this on them. And this needs to be a working document and one that all schools know how to use it. And I can never emphasize about the inhaler technique enough, and to use the inhaler with spacers. I still see every now and then people using their inhalers without spacers. And obviously, we say the minimum that people should get a review is once a year. But every now and then, I do say to people, if you have been in hospital quite a few times, then it's extremely important that you don't wait for once a year. And I think one of the big things I have learned, the difficulty is after an asthma attack, is following up with a health professional 48 hours after. That can prove challenging at times, and we do need to think of ways around that. Please continue to join me in campaigning about the impact air pollution has on health. Although we're talking about respiratory now, we now know it is linked to all non-communal diseases. So cardiovascular, 1 in 4 strokes, dementia, 1 in 5 now, lung cancer, and so many more. I hope a lot of you will take quite a bit from this conference, and it's been going all year round. I'm really proud to be a part of this team, and I do believe one day no child will die from asthma. Thank you all very much for having me. As you are all doctors, I have to be careful. I'm not going to start talking about what is asthma, as everyone knows. But I must say, please join me in lobbying with me, your local MP, everyone possible, your councillors, to make sure we get something in the environment improvement plan. Thank you very much, and see you soon. Bye.
Thanks so much, Rosamund. It's always it's always really inspiring to hear the great work that Rosamund is continually doing for us, and for children and young people with asthma, kind of raising with that profile raising. And as I said, Rosamund will be joining us for the Q&A. Rosamund will be joining us for the Q&A shortly. Sorry, apologies, technical issues on my side. So let's just wanted to also, so as well as thanking Rosamund, I'd like to start by thanking all of you for joining us today. We are all of us working in kind of health and care, for those of us outside the sort of health organisations who have joined today. It does feel very much like we're all under the cosh at the moment. Pressures are very high. There's a lot of kind of demand on services, and we're all finding ourselves having to some extent, it can feel like we're having to work extra hard just to stay on top of things. So given these kind of pressures that we all face, it's really, I'm really grateful to all of you for making the time to prioritise children and children's asthma today by joining us in this really important conference and day of profile raising for children's asthma. So yeah, it's really, it's really inspiring to have so many joining today, for taking the time to attend, but also for all of those who have contributed, not just to the conference today, but to the various different kind of pieces of work we've had over the course of this week, the kind of blogs and webinars, etc. So for joining and for those who contributed. I'd like to think of today as an opportunity to celebrate the fantastic work that's being done across the country with children's asthma. Rosamund is a fine example of the kind of work that can be done to raise the profile of children's asthma, and this is something that's being repeated across the country at all different levels by all of you and countless others more. And so I think it is really important to kind of celebrate all of that work. We will see as we go through the course of today that there is still a long way to go. We haven't cracked it. There is still a lot of work to be done, but I want to start by saying that is the case, but that shouldn't in any way negate celebrating the fantastic work that's already been done. And I think also to some extent it's the work that's been done that's helping us raise the profile, to spend the time looking for the problems. And as a consequence, we're still in that phase of by putting more effort into identifying issues, we are of course going to find them which need to be fixed. We are still in that phase, so it may seem that there still seems such a mountain to climb, but we're seeing that mountain now because of all of the work and kind of profile raising that we've been doing. I think it is an opportunity to celebrate successes and impact so far, to sort of talk about achievements. And again, that's been something that's been shared. You'll see some slides later during the breaks, sort of sharing achievements of work that's been done in other places. It's been incredible to see the growth of children and young people's asthma networks across the various different regions, and the kind of national impetus that's also behind it as well. And we'll be hearing from the national programme. And again, this is something that we have been hoping for in the asthma community for quite some time, and it's because of all of the work that all of you have put in over the years that we now see that kind of change and visibility at a national level as part of a national programme. So it is important to celebrate that, and to celebrate that growth of networks. It's also, I think, important even within this meeting today, even in this conference today, it's an opportunity to share about successes even in this conference. So if you hear something that is relevant to a piece of work that you've done or been successful of, or if you hear somebody who's talking about something that has proven difficult but you have found a solution to crack it with a piece of work, do please pop it into the chat. We can use that as an opportunity to kind of share information, share links, share contacts, and continue to even use this conference as an opportunity to grow networks and share learning. So just some basic housekeeping now. Just to let you know, as this is a Teams live event, you will all be muted automatically. There isn't an opportunity to speak in these meetings. There is plenty of opportunity for questions though, and comments. So you'll see that there's a place on your screen to enter questions or comments into chat. So the chat basically is moderated. So when you put your question in, it won't immediately appear in the chat box. That's just, as I said, it goes through a sort of quick moderation process and is then published. If it's a sort of specific point relating just to you, we may not put it into the chat. We just communicate with you directly behind the scenes. The speakers during the course of the day, if they see points in the chat that they feel like they could answer, they will have that dialogue in the chat with you. So that do keep your eyes on that over the course of the day. If you and in terms of the way we're doing questions and answers, so rather than having a Q&A at the end of each speaker, we're going to do a panel session at the end of each of our sessions. So we have the mornings divided into two sessions, as is the afternoon, and at the end of each session we'll have a panel where the recent speakers will all be there, and then we'll pose all of the questions put into the chat to them all at once. So if you have a question for a speaker, just pop it into the chat and we'll bring it up in the panel discussion. If you see a question that somebody else has put in that you also want, please just put a thumbs up. The more thumbs up a question has, the higher up our list of questions it will go. So we'll pose the most popular questions first. Right, so also yes, this conference is being recorded. At the end we'll let you know about how you will be able to access it later, or if you want to pass it on to those who haven't been able to attend today, we'll just give you all of the details about how that will be accessed. You will also have seen we have used Mentimeter once already today. We will be using it again, so do keep your phones with you. Mentimeter is fairly straightforward to use. Scan the QR code or go to the website and type the code in, and then pop your answer to the questions in. It's good to have that interactivity. Then last bit of housekeeping. We rely on your feedback every year to improve the next year's conference. So we and the team spend an awful lot of time actually going through all of the feedback, trying to ascertain feedback. So it is really, really important for us that you take the time just to let us know what you think went well, what we could have improved on, and any themes that you think would be good to pick up on for the next time. So let's move on to our next slide. So this is just starting with the Mentimeter. So as I mentioned before, we had that Mentimeter that you had that we'd asked you to fill in. So this was about the national bundle, and I know this continues to be a really important area of focus for the various different networks at ICB level and local level as well. So yeah, just always interesting to see where people are at in terms of which aspects that they are struggling with a little bit. It's quite interesting to see what's gone in there. I think looking at it here, seeing a lot about diagnostics, diagnosis. I think probably that's a key theme. I'm just scanning the image the same as yourselves are. I think lots of different people using different wording to say the same thing. Questions about the viral impacts as well, asthma friendly schools. And so I think we do have today one of our, in our first session, we're going to have the national team giving us some information about what's going on, and there will be the panel at the end where we'll have an opportunity if there are any questions to put to the national team around this. So we can move on to the next slide, please. Great. So just to take you through briefly through the agenda. So as mentioned before, the day is going to be split into 4 sections: 2 in the morning, 2 in the afternoon. So we're going to this is session 1. I won't go through everything, but we do have sort of patient voice session first of all, moving on to the national update, and then a really important piece of work around the thematic report on child deaths due to asthma from the National Child Mortality Database. So really impactful and important morning session with a Q&A towards the end. Then we have a break. We moved into the second session of the morning. So in session 2, some practical steps about empowering children and young people. The housing, something that I think a lot of people at local level are trying to work out, this housing and implementing these issues around quality of housing and mold and damp, and then a session on adolescent vaping, again very topical session, again followed by Q&A and then lunch. Then we move into our afternoon session, the first of our afternoon sessions, which is going to start with a clinical update, then a a Q&A very specific to the clinical update, because it feels like it's a bit of a standalone point. And then we move into our final session of the afternoon with some important updates or presentations from Asthma and Lung UK, and looking at the roles of pharmacy, and then thinking about severe asthma services and who are those cases who are most likely to benefit from referral. So that's our lineup for the day. So move on to our next slide, please. So what is the Ask About Asthma campaign? So yeah, this is so as I mentioned at the kind of start of the morning, this is our 8th year running this program. It's our 4th year of having more of a focus, a kind of wider national reach. What initially started as a London piece of work as over the years built up and had quite significant national attention as well, for which we're very pleased. And it's always great to see what fantastic pieces of work are being done across the nation as this week of events gives us the opportunity to really understand and to explore. So we try and keep it simple. So the campaign is all about raising the profile of asthma generally, but then also the importance of 4 key messages that we like to get across. The importance of having an asthma action plan in place, understanding how to use your inhaler device correctly, the importance of having an annual review. We've tweaked that over recent years to include the requirement of having a review after every attack as well. And then more recently, also, as Rosamund was mentioning earlier, is the importance of air quality and its impact on lung health as well. So this year's theme, in addition to our 4 key messages, we also have a theme every year, and this year's theme is helping children and young people with asthma to live their best lives. And broadly, this can mean a lot of different things, but really our ambition is to raise the profile that a child with asthma should, if they're being supported correctly, not in any way be disadvantaged compared to their peers. So we're trying to raise the idea that asthma, well-controlled asthma, should mean no symptoms or at least very, very little symptoms, but we want to set that bar really high for ourselves and say no symptoms, and you shouldn't be excluded from anything. It's just sort of trying to shift that idea away from, oh well, I can't do it because I've got asthma, which some children and young people and families sort of expect is the normal for this long-term condition, whereas the reality we all know is that needn't be the case. So that's our overarching theme for this morning, or for today rather, and for the whole campaign. So why do we do it now? Again, I think anyone who works in the field is very familiar with this graph. Asthma is always important, but we choose to do it now because of the significant peaks in asthma admissions that we always see in September as children return to school. And it just seems like the opportune moment to raise the importance of asthma and the value of good control. And we do see on this graph is fantastic period, down awful period during awful time during COVID, but did have this great time where children were so much better with their asthma as a result of decreased exposure to various different things. Pollution, probably one of them, as well as upper respiratory viruses. But otherwise, we have seen this kind of ongoing pattern. Perhaps a slight increase in admissions over time still, which is multifactorial, and I don't think I'm going to go into too much detail around that now. That isn't the purpose of this introduction. Just move on to our next slide, which I think is also highlights a really kind of significant issue again that I think we're all aware of. So this slide is tells a very important story. So if we're looking at this slide, this is talking about asthma admissions by ethnicity, and importantly, this is as a proportion of the population of the ethnic group. So this gives a sense of a kind of true sense of admission rates within ethnic groups and comparing them. So what we see here is if we look at absolute numbers, the purple line, the white group should have the most admissions. If you look at total numbers, should be very overrepresented because there are so as the largest population. But what we're seeing here is as a percentage, as a proportion of these populations, those of BAME backgrounds are significantly more likely to be admitted to hospital with their asthma, which continues to be the case and is obviously something which is super important for us and talks to all of the issues around equality and equity, which we think about so much now in managing in health and the importance of it. And again, we could overlay various other factors on here, such as deprivation, where these populations are housed in terms of quality of housing stock, in terms of areas of increased pollution, and all of these factors that are likely to be contributing. And it's a big reminder for us all that that looking after children with asthma isn't just about research into the best medicines. It's about considering the child and the family as a whole and all of the various different multifactorial elements that can contribute to better or worse outcomes, and finding ways and solutions of dealing with all of them. So just to wrap up my introduction, just going to for those of you who are interested, again, this is a campaign about raising profile. So if we could move to the next slide, please. This is about raising profile. So for those of you who are on social media, we'd like you to both on Twitter or Instagram, you can follow us. The handles are there, but also if you're using the hashtag #AskAboutAsthma, really valuable. If you could please all get on there, raise the profile, use the hashtag. Let's let people know about the campaign and what your organisation and us as a region are doing about it. As I mentioned, also there's a huge amount of other content that's been happening over the course of this week as well. So even additional stuff happening today and tomorrow also. So for full details of everything and how to access all of the various different blogs and webinars, etc., which have all been recorded. Those that have happened have all been recorded and are possible to see. Various podcasts, etc. If you go to our website, you will be able to find all of that content.